If you're anything like the rest of us, you're struggling too with our new normal since this novel coronavirus reared its head. Am I right? Maybe you've lost your job, maybe you've lost a loved one, or maybe you're a healthcare worker seeing heartbreaking things on the front lines. Or what if none of those apply to you? Do you still have a right to feel upset? Of course. Just dealing with change, whether positive or negative, is stressful. Being worried about getting sick is stressful. Trying to avoid a virus that we can't even see is stressful. So today I brought two of my friends together to talk about how do we get through whatever it is that we're feeling right now. Frustrated, angry, sad, hopeless, or just scared out of your mind. And hopefully you'll pick up some helpful tips and learn something that you didn't know before. Welcome to the first episode of the Black America's Health series. I am Dr. Ty, and today with me is Dr. Frank Clark, an adult psychiatrist, and Dr. Tiffani Bell, a child and teen psychiatrist, as well as an obesity specialist. Welcome, guys. So we're talking about coping during this pandemic, but medically speaking, is dealing with this any different than some other bad event? Like, is it just, another part of life's ups and downs and it's no big deal? Or should we be doing something special?
The pandemic is obviously something that we've not experienced in our lifetime. It's been about 100 years since the last pandemic. So it is a stressful event. Obviously, it's stressful. People are losing their jobs. Their children are not in school. They're having to balance a lot of things. But anytime you're in a stressful situation, I think it's important to take some time for yourself, journal, do something that can help you rein in the stress.
So Dr. Bell, you talk about taking time for yourself, but how does that realistically happen when maybe now you're homeschooling 2 or 3 kids, you can't really go outside, everybody's trapped in the house, maybe you have even your parents or grandparents in the house with you? How can you take time? What does that look like?
So I think for each person, it's going to look different. You are correct. We don't have time to go to the spa. You can't go out for to the mall to go shopping. So you have to be a little more creative. And for me, for instance, I have 3 very young children. So it might mean sneaking away to my room for 5 or 10 minutes and doing really quick yoga or dancing or something that can bring the children in as well, especially because they need to be active too. So I think you have to be really creative. You probably see a candle back here. Really, I'm squeezing in 2 to 3 minutes of stress relief whenever I can.
Got it. What do you think, Dr. Clark?
I would agree with what Dr. Bell said. I think creativity is important, especially during times like we're experiencing with the pandemic. And so I myself have had to modify how I do things in terms of wellness. And so my wife and I, we have a daughter who is 16 months, and she's used to being out of the house. And so especially on weekends, you can imagine having a household of 3 people when there's not a lot to do and we have to physically distance ourselves. And so having that quiet time, I think, has been important for me. And I would encourage other people, even if it's only 10 minutes, to just meditate. That 10 minutes is important, and it's a way of showing ourselves that we need to have grace for ourselves so that we can be able to function and go throughout our day.
Absolutely. So let's talk a little bit more about the science. So when we're stressed or we're fearful, or you watch, the 5th news report that tells you horrible news about this pandemic, what's actually happening in the brain, Dr. Clark, or even in the body when we're this stressed or fearful?
That's a very good question, Dr. Ty. So the best way I can describe it is our body kind of goes into this fight or flight. If you see a bear, for example, most people, when we see a bear, we're not going to just stand there. We're going to run because that's our nervous system is telling us you should fear this bear. When it comes to the media, oftentimes we are flooded with news, whether it be on our phones, whether it be on TV, and we have to be mindful that our brain, is recognizing all of this and saying this is kind of information overload. And so when we hear about deaths related to COVID, or when we see a shooting of, we'll say, in the African American community for whatever reason, and we watch those videos or we hear it in the news, that's going to be traumatizing, even though we are not necessarily involved in that incident. The fact that we are actually allowing ourselves to visualize that and what that does to the brain can be quite stressful. There's a hormone in our body called cortisol, and it gets released especially when we are under stressful times, but we have to take a break. We have to allow our body to rejuvenate and rest, and so that we can fully function, and not only mentally but physically. Stress does a lot of things to our bodies. It can raise our blood pressure, it can raise our heart rate. We may breathe a little bit faster because we're anxious, and so these are all the things that are happening in our body when it's under constant stress. And so it's even more important that I would say my recommendation would be to limit the amount of time that we're spending on our phones, looking at articles or watching the news, so that we can give our brain a break and that we can, refresh ourselves.
I definitely agree with that, Dr. Clark, because you have to protect your mind and protect what it is that you're allowing into, your psyche, essentially. What you watch, reading it endlessly on social media, CNN coming across, because I get, news alerts at 3 a.m. sometimes, wake up, I accidentally read them, or, and then you're kind of in this cycle of stress. And people don't know this, I think, but stress can actually shorten your life. And there's a study that says that being in a high stress state all of the time can take 2.8 years off of your life. So that's 3 years gone, and smoking takes away about 6.5. So it's almost as bad as smoking, and I think that we don't know stress, it's kind of like, oh, I'm having a bad day, or, life is tough, and it is tough. But if you don't deal with it now, when you're later in life, you're going to be sick. You might get, cancers or autoimmune problems. And so I agree with Dr. Clark that it's something that we need to take serious, and we have to kind of deal with it in the moment, because we didn't expect COVID, but it's here. And so now we have to adjust our expectations and kind of make the best of it.
Absolutely. I think
and we should all wear masks.
Yes. What I think is also interesting, especially when I'm talking to or coaching patients about wellness, is that we get so used to everyday stress that we think that like a baseline of stress is normal, right? So, if you're commuting to work and you're commuting in traffic, that's stress, right? If you have many kids in different sports, it doesn't always have to be bad. Stress does not always have to be surrounding bad things, right? Even good things, getting married, having a baby, changing jobs, moving across the country. Those things are happy things, but they're still stressful. Mm-hmm. So I feel like sometimes we don't even realize the everyday things that are giving us stress and like giving us a baseline stress level. And then here comes novel coronavirus, right? And you have no more reserve in the tank. Not because you thought your life was rosy, but no, your life was stressful before, and you maybe you were releasing cortisol all the time already. And now that this even bigger response is required, your adrenal glands are almost like pooped out a little bit. So, Dr. Bell, kind of speaking about cortisol and all of this, as an obesity specialist, you work with patients, right, who deal with weight concerns. Is there any connection between this stress, especially chronic stress, and trying to control weight?
Yes, absolutely. Absolutely. And when Dr. Clark mentioned cortisol, I thought, I should make sure to tell you all. But the truth is, cortisol interferes with our ability to maintain a healthy body weight, to lose weight if you're trying. There was an old commercial that used to come on late at night, infomercial, and it said cortisol increases belly fat, and it would say it like 1,000 times. They wanted you to buy a pill. Don't buy the pill. But the point is, cortisol does increase body fat. It increases your hunger hormones. It makes it so that, if you used to have one plate of food and you were satisfied, people notice when they're stressed, they start munching and they get snacks all day, and then they gain weight, and then they feel bad and get depression, So it's an endless cycle. And so it all goes back to paying attention to the things that stress you, even if they're small, even if they seem insignificant. And for Black America, I must say, we are kind of used to just shouldering on and saying, oh, well, I'll deal with that later. And now's not the time to deal with it later. Like we've got to at least address something as much as we can, because yes, it will make it hard for you to lose weight, help you gain weight, and of course lead to diabetes and other issues. So it's important to keep your cortisol in check.
And when we think about the top 10 leading causes of death in the US or even across the world, diabetes is one of them, heart disease, and we know that these illnesses disproportionately affect our community. And so even more reason to be mindful of not only how we're feeling mentally, but also how we're doing physically, and making sure that we take care of ourselves. One of my colleagues, one of the things that she would always say is, when the demands increase, self-care has to increase. And I believe that wholeheartedly.
I love that.
Yeah, agreed. That's a great point. Even if I, take a moment to even talk about myself, the last few months after my practice closed, I've really been focusing on self-care. And that was the plan even before, novel coronavirus came to be, at least in the United States. And 2 days ago, I actually got my blood pressure checked and it was down to 95/62. I don't know the last time I was that low. I actually thought their machine was broken. And I told them that I thought their machine was broken. And the lady asked me, well, have you been working the same amount lately? And I said, no. And she goes, you won't believe how many people are coming in to get their blood pressure checked. And they're all telling me my machine is broken. But because everybody's at home and not commuting and not at work in these stressful meetings, even though, we do have stress, but it's not our, like I said, our normal everyday stress, that most of the people they've checked, their blood pressures are much lower than they normally are. And for me, I'm normally in the 120s, 130s, which is still technically normal, but again, all stress, right? And it's so even if some people go, oh, stress is this like intangible thing, but it's very tangible, right? Your blood sugar levels change under stress. Your blood pressure changes over stress. There's a difference when you rush into your doctor's appointment and they check your blood pressure right away, right? It's like 160. And what do they usually do? They make you sit for a little bit.
Wait, that's right.
And then they check it again after you laugh and joke, and now it's down. Blood pressure is not one number. I always try to tell people it fluctuates throughout the day. I jump out of the bushes and scare you, it's going to shoot up, right? So all of that to say, it's not this like hocus pocus or, go meditate and you don't know if you've actually met the goal. Like it's tangibly, it is doing things to your body. So I have another question for you guys. So, we're talking about trauma and horrible things. So in the setting of what we're talking about physically, what's worse, one big horrible trauma or these little stressful or sad things happening like every single day over like 3 months? Any thoughts? Dr. Bell, you could go first.
Sure. I think that's an excellent question. I had to give it some thought, but what I would say is it depends on how you manage the trauma, right? So if you have one really horrific trauma, something happens, I'll just name a few, hopefully not trigger anyone, but you get raped or you're held at gunpoint or you see a loved one get killed, something happens. Obviously that is very traumatic. The difference is, that that's a trauma most of the time and you're able to address it. People say, oh, you need to go to somebody, talk to someone, or you are so uncomfortable that you seek help on your own. I found that when people have small micro traumas or daily assaults or something, they kind of go unnoticed and they build up. But we don't know they're building up because they're building up very slowly. And so you really have long-term effects because you never address it. You never say, oh, I've been, dealing with racism every day a little bit for the past 20 years. Maybe I should talk to somebody about that, because it just becomes your norm. So it's hard for me to judge those against each other, but I think they're both bad. But I think the one you don't address would be worse. So whichever that is that you don't address.
I would agree, Dr. Bell. I kind of liken it to, the term coined by Chester Pierce of microaggressions, those subtle insults versus overt racism. So it's one thing if, someone uses a racial slur towards you and drops the N-word. Okay, that's traumatic in a lot of ways, but, in terms of microaggressions, it may be more subtle. And so we, as all of us on this video right now, we've talked about this, so we've all experienced discrimination, whether it be in our personal life or professional life. And after a while, it's kind of like, you blow up a balloon, and at some point that balloon is going to pop. And I think that's kind of how I look at trauma or racism or anything that could impact us mentally or physically.
So one of the things that's coming to mind as I listen to both of you guys is grief, right? So I think it's pretty accepted in the medical world, and even the psychology world, that grief is a process, right? But we only usually think about grief sometimes when somebody dies, right? And so if no one in their family has died lately due to, novel coronavirus, does that mean that folks aren't grieving right now from this pandemic, or are they? Dr. Bell, you want to go first?
Yeah, I would say that they are. We grieve all sorts of things. We grieve what we thought life would be, or, an expected outcome that doesn't happen. We grieve the loss of, sadly, being able to go get your hair done, or be able to go to visit your friends, or take your kids to school. They may grieve, seeing their buddies, and little children don't know how to express that too well. But the point is, anytime someone loses something or feels like they've lost something, you can grieve. And it is a real loss to them, so it's important that we don't stand back and judge and say, oh, well, no one died, or you only lost one person, they lost 5, so yours is not important. It's not a game of comparisons as much as it is, it's real to you, it matters to you, you matter, so we need to work on your getting better, for yourself. So that's how I feel. I think we're all grieving something.
Absolutely. Dr. Clark?
I wholeheartedly agree with Dr. Bell's sentiments. The one thing I see a lot when I'm working on the inpatient unit and providing care for my patients, they often do compare. My peers' story is more horrific than mine, and it's like, well, what evidence do you have that their story is more horrific than yours? I mean, again, if you lost a pet. Pets are very important to people. We don't own any pets, but if you lose a dog, talk to me people who are animal lovers, they're going to tell you that they're grieving. And so just because someone lost a pet versus someone who lost their grandmother, that's still loss. We talk about job loss. You mentioned this pandemic. A lot of people have lost jobs. That is significant, especially when you're trying to feed your family, or if you're the sole provider of your family. As physicians, we have talked, you and I and Dr. Bell have talked about physician pay cuts. That's a loss, even for a physician who, does, financially well. But if you're taking care of a family, you still want to put food on the table and know that your family is going to be taken care of. So we all go through loss, but we don't want to minimize it. I think that is the worst thing we can do is invalidate ourselves, so to speak, of saying like, well, my loss doesn't matter because, to your point, Dr. Bell and Dr. Ty, I didn't lose a loved one. We are all grieving. I'm grieving a loss that I'm not able to go to the YMCA because it's something that I enjoy, but I've found other ways to be creative in terms of my wellness. And so everything that is important to us matters. And to Dr. Bell's point, we are important. We matter, and we should be able to voice that and say, this is how we're feeling. This is my trauma, or this is my loss, and be okay with that, and not say, well, yours is better than mine, or yours is insignificant and mine isn't. So we need to just be real with each other and support one another.
Absolutely. The worst phrase, I think, is, it could be worse. That, like, instantly right there, you're minimizing and invalidating how you feel, right? So, you mentioned, Dr. Bell, talking to someone. This is always a sticking point. There are definitely people that in 2020 have accepted therapy as a means of coping. But I'm sure we can all think of at least a dozen people who would be a hard sell, especially culturally. We are probably more inclined to talk to our friends, our family, our pastor, long before we get to talking to a trained psychotherapist, particularly someone who's trained in trauma, that a lot of us don't realize what we've been through is trauma. You know, and you mentioned therapy and people shut down. So, you know, you guys know we've talked about this offline before about like, I think everybody needs a therapist, right? Like life is hard. Sometimes it sucks, right? And nobody, no matter your race, your ethnicity, your socioeconomic status, how much money you got in the bank, nobody leaves this earth unscathed, right? Something bad is going to happen, whether little or big. And, you know, to a lot of who we are as adults, for better or worse, has even come from things that happened long ago in childhood that we just need to work through, right? So I think it gets a bad rap, honestly. I'm not a therapist, but I believe that, you know, what they do is great work, right? True. And, you know, it's just, I feel like I hear a lot of, even now, I hear a lot of like, if it gets bad enough, I'll go. And, you know, it's not a judgment, but it's like, I almost want people to start thinking about it as preventative. You know, like, don't wait till you're losing your mind. Like, just go. We have online therapy now. We have, you know, you could even do couples counseling. Someone told me they were doing online. So, you know, I don't know if you want to jump in and add your feelings, Dr. Clark, if you want to go first. But, you know, I just think we need some ways to cope. What do you think about therapy as a means of coping?
So what I would say is that, you know, Dr. Clark and I actually do psychotherapy or at least we're trained in it as part of our residency and training during after medical school. I think therapy is very important. I think it's helpful, but to be real, in the African American community, there's a huge stigma against mental illness in general, mental health, you know, saying that you've reached the point of needing a therapist, or, you know, it's almost like it's a failing, a personal failing, a character flaw, a weakness. And I just don't see it that way. I think that if I had diabetes, I would go get my insulin. There are people who don't take insulin either, but I think they should, you know. I would try to eat a little different, you know, I would do something to help myself. And I think with any mental well-being, you know, not feeling depressed, not feeling stressed, going through a trauma, it is okay to seek help. It is okay to talk to someone, and they're not in your business. I mean, truly, it's not like you go into the gossip on the corner and you tell them and they're going to tell all your friends. You are working through things that have caused you to think differently. And they basically are just teaching you how to think in a better way so that you can feel good. Like maybe you learn not to compare yourself to others, or maybe you can learn to find some joy in hard times. You know, so there are things you can work on in therapy that I think are essential. And we have to stop getting in our own way and just don't think it's a personal failing, because it really isn't. And I'm sure Dr. Clark has something great to add. So.
I would agree, Dr. Bell. So for self-disclosure, I do my own therapy twice a week, and I've had a therapist for over 10 years now, and I find it to be, lack of a better term, therapeutic. It allows me to be a better physician. It allows me to be a better husband, a better father. And especially during this time of the pandemic, you know, we talked about, again, when the demands increase, self-care has to increase. You know, we are all on the front line, so to speak, as healthcare providers. And I'll be honest, there have been days where it has been difficult to go into the hospital because you are literally drained. You don't have, you know, that compassion fatigue sets in, and you're like, how much do I have to give? And then, you know, all three of us have families that we're taking care of. So at some point, you're going to break, so to speak. And before that happens, you have to, I think it is extremely important that we focus on our self-care. So I'm a huge advocate of therapy, and especially when it comes to Black men. I will say that our Black women are doing better when it comes to seeking therapy compared to Black men. And some of that is a pride issue. Some of that is historic, but we have to be willing to show emotion. I think men in general, we're taught, you know, you don't cry, you don't show vulnerability. Well, I think that's a crock of crap. We have to I mean, we're human beings. We were born to have emotions and feelings. And so if we don't, my fear is what we often see, again, going to that kind of balloon analogy, that balloon is going to burst. And we often, if we're not going to see a therapist, what I would call, you know, engaging in healthy coping skills, we're more than likely going to engage in unhealthy coping skills, and that's going to involve substances. That may involve getting involved in risky behaviors, things that we normally wouldn't do. And so we know that that has consequences. Therapy, there are no consequences. What's the worst thing that can happen? You express yourself. You're vulnerable. That's a beautiful thing. So I agree that we all need our therapists. The last thing I'll say about that is that, at least in my experience, and Dr. Bell, Dr. Ty, I would love to hear what you would think about this. I find that therapists are unbiased. If we talk to our friends are going to be biased because they're our friends.
Right.
And now all three of us, we keep it real with each other, but at the same time, having a therapist that doesn't know you and comes, in a non-judgmental way and says, okay, I hear you, I accept you for who you are. I'm going to help you process your feelings, and so that you can have a better quality of life and flourish.
Yeah. That's awesome.
Absolutely. I always tell people that, I say, look, it's like a friend that you pay for, right? And then you don't have to see them at dinner either, right? If you're worried about being vulnerable, you see that person when you see them. It's not like you have to pass them in the store, or you have to see them at lunch in the cafeteria, and then you have to feel some sort of way. That's it. And I just want to point out too, the feeling of that, oh, they're in your business. But remember, legally, doctors, therapists are all bound by HIPAA, which is the privacy laws. So they can't go out into the world and talk about what you tell them in that room. They can't disclose. You might walk past your therapist in the grocery store and want to wave. They might not even say, they might not even say anything to you, because they wouldn't want to, break HIPAA if someone recognized them. So just keep that in mind as well. I would definitely say for folks. And I do want to talk a little bit more about coping, but I wanted to say one other thing is that, I'm saying this to folks who might be going through this, or the family members. I think sometimes we see what I'll call certain bad behavior, and we make it a character flaw instead of a mental health issue, right? And, Dr. Bell always says everybody has mental health, right? Because we have a brain, right? You have physical health, you have mental health.
That's right.
So it's not a terrible thing, but sometimes the acting out that we see and the people that we love, whether, like you said, Dr. Clark, drugs or alcohol, even if they may not be necessarily addicted to that substance, if you notice that a loved one is drinking more than they normally would, or maybe they've gone through 2 weeks, they've been drinking every single day, you may want to say, hey, is there something going on?